see that we're going to have 4 chambers to the heart. The first part is going to be right atrium. If that's the right atrium, Mr. Gilmore, this has to be the right ventricle. So right atrium, right ventricle. But there's a valve that connects the two. We're going between the right atrium and the right ventricle. I'm going to have what we call the tricuspid valve. When I leave here, Mr. Gilmore, this area we call the right ventricle, I got to get out of here and go toward the lungs. In order for me to do that, I got to go through this next valve called the what? Pulmonary semilunar valve. Pulmonary semilunar valve. I enter what we call the pulmonary trunk, and then it's going to go to the right or left. Now, what is this going to be, Mr. Gilmore? These are going to become what we call the pulmonary arteries. If these are the pulmonary arteries, what are these two fellows right here coming back to this area? Going to be the pulmonary veins. The pulmonary veins is going to dump the blood into what we call the left atrium, but Mr. Gilmore, in order to get from the left atrium to this largest chamber at the bottom of the left ventricle, I got to go through another valve. What's that valve going to be? This is the bicuspid or mitral valve. Bicuspid or mitral valve. So my hint for me to remember, Mr. Gilmore, if I'm leaving the left atrium going to the left ventricle, I got to go through this valve called the what? Bicuspid or mitral valve. If that much is true, Mr. Gilmore, I got to leave the left ventricle, and there's going to be another little valve that I can't see that's going up this way. And it's going to enter into what we call the aorta, Mr. Gilmore. So if that much is true, that's going to be the semilunar aortic valve. The semilunar aortic valve that's going this way. We will have to tilt it a different way. Now, if that much is true, Mr. Gilmore, I got what we call the ascending aorta, the aortic arch, the descending thoracic aorta. Do that again. The ascending aorta, the aortic arch, and then the descending thoracic aorta. If that much is true, the first vessel that comes off this arterial supply, Mr. Gilmore, is what we call the brachiocephalic artery. After the brachiocephalic artery, which is going to split into two, we're going to have what we call the right subclavian come off, and then we're going to have what we call the right common carotid. If we got a right common carotid, that means we got to have a what? A left common carotid. So the left common carotid is the next valve that's going to come, the next vessel that's going to come up. Mr. Gilmore, if that much is true, then I got to have a what? A subclavian. Because I had a right subclavian, now I got to have a what? A left subclavian. All right, that helps me with understand that, Mr. Gilmore. What's this schematic that, or this contraction that's folded back? Well, this is going to be what we call the right auricle. If this is the right auricle, this other piece on the top of this is going to be called the left auricle. All right, Mr. Gilmore, we got that. Well, what's this valve right here? You're going to have a valve right here we call the superior vena cava. But I'm going to show you in the cat that what we call the azygous vein comes and dumps into the superior vena cava before it dumps into the heart. On the bottom, what you can't see is what we call the what? Inferior vena cava. But both of them then want to dump their blood into what we call the right atrium. All right, Mr. Gilmore, I got that. What's this funny looking piece right here? We got the pulmonary trunk connected to the arch of the aorta by way of this cute structure right here. Now, in the fetal heart, we're going to call it ductus arteriosus. But because we're in an adult heart, we're going to call this the ligament arteriosus. The ligament arteriosus. All right, Mr. Gilmore, I need to see this live so you can kind of walk me through this. If you notice, we're going to look here. We got this cute little structure, Mr. Gilmore. Close them all up. There is some kind of sulcus that goes here. What you going to call that? Longitudinal or ventricular sulcus. Longitudinal or ventricular sulcus. I would stick with longitudinal because it's easier. Why was it easier, Mr. Gilmore? Because on the back, you're going to have what we call transverse sulcus. So my transverse sulcus is on the back. My longitudinal sulcus, Mr. Gilmore, is on the front. Now, Mr. Gilmore, I want you to point out all the stuff I didn't get to see before. You're going to notice that there's two ventricles here. There's a left ventricle and a right ventricle. Well, there's something that divides them in half. It's called the interventricular septum. The interventricular septum is going to divide the two what? Ventricles. Well, Mr. Gilmore, it's got to be, if there's an interventricular septum, there got to be interatrial septum. That's going to be up here. Now, Mr. Gilmore, if you were to tag any of these vessels on the outside of the heart, right now we don't have to be very specific and learn the great, the main vessels like that. If I just tag in one of them, you're just going to say coronary vessels. Now, Mr. Gilmore, what if there was fat on this? You're going to just say adipose. But Mr. Gilmore, what is this unique structure right here? Well, because it's on the bottom of the right atrium, we're going to call that inferior vena cava. Inferior vena cava. Now, Mr. Gilmore, I'm kind of understanding this, but kind of walk me through one more thing. Tell me the different layers of this. Now, there's an outermost layer of the heart. We're going to call it what? Epicardium. There's a thick layer of the heart. Mr. Gilmore, we're going to call that myocardium. And then there's an inside lining of the heart, Mr. Gilmore. We're going to call that what? Endocardium. So I got what? Epicardium, myocardium, and endocardium. But Mr. Gilmore, there's something that envelopes the entire heart. It's a sheet that goes around the entire heart. What's that? It's called the pericardial sac. The pericardial sac. If that much is true, Mr. Gilmore, point out to me what's going to be these little structures that go from wall to wall. That's going to be trabeculae tendineae. Trabeculae tendineae. Well, Mr. Gilmore, hold on. What are these little cords that's going to go on each of those valves? Those are going to be what? Coordinate tendineae. Think of cords. Coordinate tendineae. So the coordinate tendineae, Mr. Gilmore, go from these cute muscles you're going to call in a second to these valves that we just called, and those are called coordinate tendineae. Well, Mr. Gilmore, what are these muscles that's found in the ventricles? Those are called papillary muscles. Papillary muscles. That's basically what you got to know for the test. But here's what we're going to do. To make sure we got all the things that we need, we're going to try to go through. Should I stop it? All right, Mr. Gilmore, show me what we're doing. We're going to point out each part. This right here is going to be called my apex. If this is my apex, Mr. Gilmore, then I can tell you right now, this is what we call the longitudinal sulcus. If this is longitudinal sulcus, Mr. Gilmore, that makes this fellow right here transverse sulcus. Transverse sulcus. This cute little stuff that you flapping around that heart, Mr. Gilmore, that's called the pericardial sac. Pericardial sac. If that much is true, Mr. Gilmore, you're going to notice that there's this cute little ear flap right here, and there's another ear flap right here. The one that's on the right, Mr. Gilmore, we're going to call it right auricle. On this side, we're going to call it left auricle. Mr. Gilmore, all this yellow stuff that's on the outside of this heart, we're going to call that adipose. If I was to tag any one of these vessels, Mr. Gilmore, you're going to call those vessels coronary vessels. Now, Mr. Gilmore, tilt this so I can see this. You're going to notice that there's this unique structure right here that's on the top, Mr. Gilmore. That's going to be my pulmonary trunk. But Mr. Gilmore, what's this at the end of the point? This cute little structure right here is going to be what we call the aorta. If that's the aorta, Mr. Gilmore, what connects the two? The ligament arteriosus. Ligament arteriosus. So if I were you, Mr. Gilmore, I would remember the pulmonary trunk is in the front and the aorta is the back. And what connects the two is the ligament arteriosus. If I know that little road map, I can't get these wrong.
What's the thing your thumb is on?
Just hold what you got. I'm about to stick probes in all this. Just give me a second, though, because I need to. Here's what I'm going to do. And the way you can't get this wrong is we have to probe it. That probe ain't long enough. We're going to make it long enough. Now, some of y'all can see this. You see where there's a probe in the top? You see this? And there's a probe in the bottom. This is what I would have to do for tests. So what are you doing, Mr. Gilmore? This will mark superior vena cava. This will mark the inferior vena cava. You see that? That's the first one.